Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss the importance of strengthening your hip muscles after knee replacement surgery. Before I get into that, be sure to hit that subscribe button below and turn on the notifications if you're interested in catching regular videos related to knee replacement surgery, exercises, rehab, recovery, frequently asked questions, and everything else. So why is hip strengthening important after surgery? Well, your body is an interconnected chain. And what I mean by that is something that occurs at one body part or one joint is going to have effects throughout your body. So for example, things going on at your hip and your pelvis are going to have effects at your knee and at your ankle. In the same way that things going on in terms of mechanics or strength or movement at the knee joint are going to have effects on your ankle and your hip. So when you're walking and doing functional movements, going up and down stairs, getting up from a chair, squatting down, standing up, whatever it may be, your hip muscles have to have a certain amount of strength to provide good alignment and good mechanics of your hips and of your legs and knees in general. So if you have weakness, what you can possibly have when you're doing these functional movements is tilt or unevenness of your pelvis. So the alignment and evenness, equalness side to side of your pelvis can be affected, and this can lead to then effects going down the leg. They call it medialization is the most common. So if you have hip drop or your hip drops when you do an activity or go downstairs or stand up from a chair, and then your knee is going to cave inward and your ankle might pronate or angle or bend outward. And so anything going on at the hip joint is going to affect the whole leg. And what this means is you're going to have increased stresses through that knee joint. Increased stresses, increased forces, and they're not going to be distributed, these forces. They're not going to be distributed as equally from side to side throughout the entire knee joint. So certain parts, particularly maybe the lateral or the outside part of the knee, might have more stresses and more forces. And what this means is more pain, discomfort, stiffness, probably more difficulty tolerating walking and movements and activities, more difficulty tolerating exercises potentially, and honestly just an increased chance of having some breakdown of the knee joint. So we want to build up that strength in the hips. And that's very important. You know, you say, oh, I had a knee replacement, but we want to focus on the whole body, especially the hips, the knees, the ankles, the calves. All of those areas are going to have a part and play a part. So building up that strength of the hips is going to affect your alignment, your mechanics and mobility with all sorts of movements. It's going to help alleviate stress through that knee joint and help you better tolerate your exercises and activities, get you moving sooner, get you tolerating things sooner, and hopefully recovering sooner. So adding strengthening and stability exercises for your hips are very beneficial and is very helpful after knee replacement surgery. I hope you found this insightful. If you have any questions or comments, be sure to leave one below and I'll be sure to get back to you. Again, please be sure to hit that subscribe button and turn on notifications if you're interested in catching all of our videos I post every other day on all variety of topics related to knee replacement surgery. Thank you very much for watching.